Welcome back. Now, a fleet of ambulances are being used to fill the gap in Somalia's public services. Africa 54's health correspondent Linord Moudou has the details.
After he watched the neighbors injured by bomb blasts bleed to death on the way to hospital, Somali dentist Abdikadir Adem spent all of his savings on a battered van to ferry wounded people to hospital. 10 years later, his single van has grown into a fleet of second-hand ambulances, Amin ambulances. The vans are instantly recognized on the battle-scarred streets of Mogadishu.
The first ambulance I paid, I remember the only money I was having, 4,200 I paid. And well, my family was telling me to stop this job because they are saying it was quite risky and you will be definitely in risk. So I didn't. I decided to start the free ambulance service. I paid the first money, which was 4,200. The only money I was having at that time.
The 10 ambulances are imported second-hand from Dubai for around $5,000 each. They have basic first aid equipment, a stretcher and a bench for paramedics or a second victim. The service costs around $12,000 per month in gas, salaries and supplies, but operating an ambulance service can be dangerous work.
There
had been heavy fighting that day when one of our ambulance drivers went to help the injured people at Hawadak district. When he was picking up people and the artillery gunfire hit the ambulance, he lost his life.
Somalia is currently facing severe drought and hunger. The country has been mired in conflict since 1991. Nairobi-based think tank Saharan Research says at least 723 people were killed and nearly 1,200 injured in bomb attacks in Somalia last year. Most are civilians. In 2008, Ethiopian troops battling Islamists obliterated an Amin ambulance, its driver and a patient with a tank shell. Last February, ambulance crews narrowly escaped a secondary blast that erupted moments after they transported patients from a blast to the hospital.
Yeah, Amin ambulance is the first, because it is the only free ambulance service in Somalia, whole Somalia, especially in Mogadishu. And we are not dealing only the explosions, but also we deal with pregnant women. We took from the home to the hospital. We took the children who's in diarrhea, the people who are in need to the hospitals. We took them from their home to the hospital. We deal every type of emergency.
International aid agencies such as the World Health Organization, the Red Cross, have helped sometimes. But the vast majority of cash comes from Somalis themselves. Aden also spends his earnings as one of Somalia's few foreign-trained dentists.
My dream is to reach whole Somalia, everywhere in Somalia, to bring an ambulance, plus helicopter ambulance. They're coming soon, inshallah.
For Somalis, Amin ambulance crews are homegrown heroes. Linord Moudou, VOA News, Washington.